Greetings. Good afternoon. My name is Rada Joy. Thank you for joining on this afternoon, the last day of May, which is the last day of Better Speech and Hearing Month at the end of the 2024 school year. And I appreciate you taking the time out of your day to join, to tune in for this training. I felt it was important to share this information with you all, with families, with our kiddos, to look at a holistic approach to looking at health and overall functioning related to breathing, posture, tongue, oral musculature, myofunctional therapy to help our children breathe better, eat better, sleep better, and speak better. Let me share the slides. Okay, whoops. Still learning how to be a good presenter. But here goes nothing. Hopefully we can get some interpretation. There is Spanish on the slides. Okay, so this presentation, Breathe Better, Sleep Better, Eat Better, Talk Better. First, a little bit about me. I'm a speech pathologist. My name is Rada Joy. I work for Northwest Regional ESD. I've been a speech path in the Portland metro area for almost 20 years now. I'm pretty new to the 3 to 5 population and working for Beaverton Early Childhood Center as a community speech pathologist. But I've worked in the schools. I went to PSU for graduate work in speech and hearing sciences. I worked for Columbia Regional Deaf and Hard of Hearing program. That was my first job out of college. I'm a hearing conservationist. I have a business called Pet Plugs. I'm also part of the startup team programs for Gigi's Playhouse, the first Northwest Down Syndrome Achievement Center. My son, Zach, has Down syndrome, and we're opening a center that will be open in August. Also, I used to work at BreatheWorks. Much of this presentation today is about oral pharyngeal disorders, about myofunctional therapy, so I'll get into that a little bit more. But BreatheWorks is a clinic, Corinne Jarvis, so I have to give her a lot of credit for slides and training that I got from working at last year in 2023. Okay, so moving along. We're going to talk a lot about the mouth today. Let's see if I can go to the next slide. Okay, the mission really is for our children, for them to be their best, for them to be healthy, for them to thrive through improved functioning with child-centered care. As a speech language pathologist, I have a large scope of practice. We do work on language. We work with kids with autism. We work with kids with different articulation and speech delays. We work on stuttering, fluency, voice disorders. But a big area of thinking about producing speech is really knowing how everything works with the system. So I'm going to talk a lot today about the mouth, the oral pharyngeal cavity, oral myology, complex system. You probably know that there are many muscles in the tongue, and it takes a lot of different tongue muscles to produce a single speech sound. A lot of those same muscles are used for breathing, swallowing, and eating. So, and clearing our teeth. I'm going to talk a lot about dentition and jaw support, stability, and they're so important. It's hard to look at one aspect of a child or a person or eating or breathing, speaking without looking at the whole person and how they are functioning. So here's a picture with a bunch of different pictures. Oral pharyngeal dysfunction, oro meaning mouth, pharyngeal, the palate, dysfunction means something's not going right. Oral phase dysphagia is what we would talk about if swallowing disorder is a thing. So you see in utero, you see the noxious habit of thumb sucking, definitely changes dentition, definitely changes the shape of the palate. The open mouth breathing, I'm going to talk a lot about breathing today. The runny congested nose and how that impacts mouth breathing. Obstructive airway. The picture with the dentition looking at how the teeth are lining up. the malocclusion and the eruption of the teeth in the bottom picture. And the surgery with the people with the clinical masks, that's probably like a tethered oral tissue issue, TOTs, or like a tongue tie, a short lingual frenulum. So a frenectomy, a lingual frenectomy is probably what you see there. Okay, let's see, going along. So chances are, if there's challenges with like eating, and there's more of an issue there. So we really have to start with the core. We have to start with breathing better, okay? My son, who has Down syndrome, he's 13, he's a real mouth breather, okay? There's many different problems with that. He's not getting as much oxygen to his brain. There's a lot of research that shows you get 20% more oxygen breathing through your nose than you do through your mouth. The nose filters out all those different particulates in the air. Not only that, if you breathe through your mouth, you're subjecting your teeth and cavities and oral dentition to all the particulates in the air. So it's very important to be a nasal breather. More nasal breathing is better for memory, better for cognition, and you are less susceptible to disease with being a nasal breather. I also mentioned tooth decay. You might have more problems with dentition and tooth issues if you're a mouth breather. Next slide, posture. Posture is a big thing. So we talk about respiration and how in order to speak and breathe and live and be healthy, you have to have the diaphragmatic breathing. The muscle pushes down, allowing for our chest, our lungs to fill with air, filling in for phonation through the airway, resonance into the mouth, and finally with articulation. That's how we speak. We need good breath support to speak. For overall health, we also need that good posture. So it says there's no distortion on one part of the body that is not reflected throughout the body. When we establish nasal breathing, we see and improve the entire body posture and head levels. Okay, next one, sleep quality. Let's talk about sleep. We talked about nasal breathing. We talked about posture. Let's talk about sleep and breathing better. You know, it's obvious if you're not sleeping well, you're not going to be feeling well. If you're not breathing well, you're not going to be sleeping well. There's a lot of research about obstructive sleep apnea, or OSA. You don't have to be older to have obstructive airway issues. So depending on the adenoids, the tonsils, the nasal breathing, the congestion, the tongue tie, the tongue positioning, but really you need to have good breath support to have better sleeping and better memory and just overall well-being. Obstructive airway or airway dysfunction is going undiagnosed and has a significant impact on education, mental health, and physiology of the body. Specifically, sleep disorder breathing can have a significant impact on focus and attention and a lot of lifelong comorbidities. So obstructive airway, OAS, can significantly have health impacts on the body. In other words, not breathing well can lead to just a variety of different issues. Okay, so here's some other signs of sleep disorder. If your kid is a teeth grinder, a snorer, a mouth breather, bedwetting, attentional problems, difficulty waking up, restless sleep, night terrors, difference in facial structure, these all might be indicators of obstructive airway, of sleep disorders, that type of thing. Another whole list of things to look for. Unfortunately, this presentation has a lot of like signs of, you know, look for this, look for that, teeth grinding, mouth breathing, tongue tie. Again, that's that lingual frenulum not getting up to the roof of the mouth. I might talk about this in a later slide, but basically your tongue is your natural toothbrush. Your palate, your tongue is your natural palate expander. You hear a lot about palate expansion these days. because kids like my son, Zach, who has Down syndrome, but doesn't necessarily have that real low muscle tone with open rest posture. He does have Down syndrome, but you don't see that, but he's not getting his tongue up to the palate. So he has a tall, narrow palate, unfortunately. He's a mouth breather and he's not able to really suck up his tongue. And if you think about it, I'll talk about some of these other things, but if you think about it, so much of our speech is produced up there on the alveolar ridge. And when your good posture for your mouth and your oral cavity is lips closed, nasal breathing, tongue up, slightly suction to the top of your mouth. Okay, so a couple more just other kind of telltale signs of maybe sleep apnea, obstructive airway, difficulty with breathing, mouth breathers, dark eyes, circles under the eyes, learning difficulties, snoring. There could be allergies, asthma, delayed speech, speech disorders that don't remediate after a few years after learning them. The kid knows how to produce them, but just really can't do it. Maybe that's a tongue mobility issue, not being able to reach, or maybe that tongue thrust, not really having good control of the tongue. Drooling might be, that's not on here, but drooling might be an indicator of having some breathing or tongue disorders, maybe some aggression, attentional issue, receding chin. So I don't know if I get to this in another slide, but I can't stress the importance of chewing, eating, jaw support for speech, A-E-I-O-U. We don't talk like this. If you don't eat and chew and grind, and when we start and we're babies, we have rotary chew, but as, or sorry, we have munch chew, nom, 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 or when we're suckling bottles, but as we get older, we want to have that grinding lateralization with the tongue. If we don't have that, we might get kind of a horsey looking face with the chin. Chronic fatigue, restlessness, nightmares, anxiety, crowded teeth, swollen tonsils, stunted growth. Okay, so let's talk about eating now. When we talk about oral phase dysphagia, we're talking about that process of swallowing. It's really important to have tongue control to be able to swallow that pill, swallow any food, that's masticate. So the oral prep phase is often overlooked, but it's very important. How people chew and start their swallow is their natural exercise for their tongue. We swallow 2,000 times a day. Imagine that. This is as well as resting posture. It is the function that aids the facial formation and strengthens the tongue. I can speak. So eating, I can't stress the importance of eating, kids eating. I did my son a real disservice when he was young. He ate so many of those pouches. That's all he had to do. He didn't have to chew the meat off a bone. He didn't have to chew the licorice. He didn't have to bite. He still doesn't like, because he has that high narrow palate. My son does not eat like breads, muffins, bagels, really cake or anything kind of like chewy and doughy. It's too hard for him to have that muscle control to swallow it. So it gets stuck in his palate. So I can't stress the importance enough about having your kid be a good eater, chewer, chomp on things, variety of textures. Our tongue is our natural toothbrush. We should be able to use our tongue to clear our teeth and all the sockets. You see a lot of older people with dentition issues, with cavities in the back, because they don't have the tongue mobility. Same with if you have a tethered oral tongue tie issue. If your lingual frenulum, if you have a posterior or anterior tongue tie, you're not going to be able to get the food. If you're not closing your lips, you're not able to produce that suction for a swallow. Okay, we're up to speaking. Speaking with confidence opens doors to endless opportunities. Effective speech improves your ability to form connections, influence decisions, and motivate change. It's integral for self-concept, problem-solving, self-understanding, and confident communication. Okay, so we can't really talk about speech without talking about all those things. Like we talked about respiration. We talked about tongue posture, jaw support, mastication with chewing and eating and swallowing. So at BreatheWorks or at some of these myofunctional clinics, you don't even get onto speech and why the kid isn't really producing a lot of speech sounds until you've addressed the whole oral pharyngeal cavity. When you think about the pharyngeal part of the swallow, using your tongue to go across the palate for the swallow. It's the same thing for speech. It's pretty hard to do an R sound or an L sound if your tongue doesn't have the mobility, if your tongue is not able to produce those sounds. So again, think about that ability to produce speech, respiration, diaphragmatic breathing. It starts with that. Then we have our lung support. We fill our air with lungs, respiration, phonation into the oral cavity. With any weak muscle tone, it's hard to produce sounds. If you don't have lip rounding and shredding it's pretty hard to produce a siren sound, E-O, or a word like she. Yeah, you need to do a lot with your articulators, your lips, your tongue, your teeth, your jaw. The vowel sounds A, E, I, O, U. They're not for intelligibility, for good speech production. Lots of oral functioning. Form follows function. You need to have that mobility. Okay, did I say all that? So if you have some of those signs, I'll go back to the last slide. If you have some of those signs of oral pharyngeal dysfunction, it's going to be really hard to have speech on time. I mean, not always. Some kids have sleep apnea or some of these symptoms of oral pharyngeal dysfunction and speak just fine. But generally with the little populations, if they're not producing a lot of speech, if they're not able to closed lips for a pa, 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 ma, 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 ma. Those are all bilabial, so your lips need to be closed. When kids are little, you might hear ta, 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 with the whole jaw going up and down, ta, 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 ta. But as they get older, you want to see, I'm going to go ahead and close this. You want to see the tongue, ta, ta, not the whole jaw, ta, 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 with the whole tongue. The isolation with just that muscle. The only sound we produce in English with our tongue out of our mouth should be like the TH, voiced and voiceless. So if you're hearing a kid like with a mouth, and I did this with a lateral or frontal lisp type sound, mushy speech, that's because they're not having their tongue resting on their palate. So simple things you can do at home. Clicking, getting that tongue up there. Put a little something up on the alveolar ridge, a little bit of jam or Nutella, and try to get the kid to put their tongue up there on the alveolar ridge. Okay, we're almost in the end of this here, folks. Let's go to the next one. We want our kids to feel better, stand tall, pain-free, have proper nutrition with lots of fruits and vegetables, crunchy foods, soft foods, chewy foods, hydration. Can't stress enough about water and having a really good ability to swallow without drooling. Respiration, posture, oral mechanisms, good tongue control, swallowing efficiently without having to suction. They're really the keys to take the world on at any age. Form follows function. So here are some pictures of a high, narrow palate down at the bottom. Your tongue is your natural palate expander. I already said that. You're sucking on your tongue, on your thumb. Your teeth are going to grow like that. You see this open bite posture. So really, in any of these issues, you want to put together your child's healthcare team. Starts with the pediatrician, of course, the specialist, the dentist, the orthodontist, ears, nose, and throat doctor if you have any concerns about, obstructive airway, breathing, sleep apnea, tongue tie. Both some dentists and ENTs do the lingual frenulum frenectomy clipping. Myofunctional therapists, there aren't that many of them in Portland, but Sunbreak, I believe. Danny is a speech pathologist. Linda D'Onofrio, BreatheWorks. Some regular clinicians have experience. So Parkwood, I think. So specialists. So your team, not only your speech pathologist. So at Northwest Regional, we're very educationally based. So there's not a lot of training around oral functional myology, but speech pass, it's in the scope of practice to discuss, well, I see your child is really have a lot of excessive drooling, or they're not eating solids, or they're not opening and closing their jaw a lot, or their tongue is hanging out of their mouth, like the children with Down syndrome. Weak muscle tone. You can strengthen your tongue. Your tongue has many muscles, just like exercise. I call speech therapy a lot of times like the gym for your tongue. Suck up that tongue. Push into your cheeks. Put your tongue from your alveolar ridge in the sweet spot and roll it back. Here's some additional pictures of the tongue, some lingual frenectomies, some tongue tied. You see in the bottom right, these heart-shaped tongues are cute, but that's an indicator that the lingual frenectomy or lingual frenulum is it's tethered oral tissue. If that's too constructed, it's gonna push in the tongue like a heart shape. So those are kids that need to get a frenectomy. The tongue, if the tongue isn't able to protrude and be skinny and get round and go into a bowl, you hear those kids with R problems for many, many, many years. What kind of tongue restrictions do they have? Tongue tie versus tongue weakness. That can be better indicated by a myofunctional therapist, a dentist, an ENT. But the palate expander and the lips are the natural braces. Don't want that tongue out of the mouth. Can the tongue reach the palate for suction without compensations? Where's the tongue resting? We want to look at how the tongue limits function. If you cannot lift your tongue up to the spot, you can't produce those alveolar sounds, as I already said. For chewing, swallowing, dysphagia, all those different issues with swallowing and eating and feeding, you cannot clear the cavity if you have a tongue tie. I think I said all that. Anyway, so I'm going to wrap up, and the takeaway is that our mouth, our oral pharyngeal system, oral myology, it's a complex system. We use all those muscles in our tongue for all these different processes, everything from speaking to eating and drinking, to clearing our teeth. Dentition, jaw stability and support are so important, and we really can't look at a child one aspect without looking at the rest. Chances are, if there's challenges with eating, there are other issues, and that this isn't going to be fixed with some home intervention. You're going to need some medical intervention with your medical team. Your child needs the whole team of specialists that I just talked about and coordinated care. We're not medical providers at Northwest Regional. We're educationally based. So if there's concerns, going for a comprehensive assessment at one of those clinics or asking your dentist or pediatrician for a referral to take a deeper look would be best. I know my son has really benefited from working at BreatheWorks. He is working on his strengthening muscles, working on getting his tongue lifted to his palate with that high, narrow palate. We talked about palate expansion, but we sort of missed the window. That would have really benefited him. He's at risk for choking if he can't clear his palate. I did have to give the Heimlich. If he's not chewing and lateralizing, giving a grinding chew, it's harder for him to move the food back. So my son lacks that ability to suction up to the palate. These are all cautionary tales. I'm not trying to be, doomsday with all these things. If you see these indicators, your child might have a problem, but it is to be very holistic in our approach at looking at our kids and how they're functioning. In conclusion, this is a process. Working on health and optimum health for our children and ourselves is a process. Baby steps, little tips to takeaways for our children to work on that breath support. Work on nasal breathing. Work on getting the lips closed. Work on getting the tongue elevated. Tongue movement, lateralization, the free movement of the tongue for swallowing, speech, chewing. I can't say enough about jaw stability. You know, on a kid that has jaw sliding and their jaw is all over the place. Think about speech and how we need our jaw. Uh, and singers, resonance. We can't have resonance without moving our jaw if your jaw's locked or tied. So thank you for your time today. If your child is suffering from any of these symptoms, like I said, talk to your pediatrician, go to your dentist, go to your orthodontist, make an appointment with an ENT, set up an evaluation with a clinic that specializes in myofunctional therapy. That is the solution. If you have any questions, Rada Joy with Northwest Regional. I'm rjoy at nwresd.k12.or.us. And again, in gratitude for BreatheWorks, Corinne Jarvis. She does amazing work in this community and then it has a lot of expertise in this field. And there were some references too. Thank you so much. And I hope you have a wonderful rest of your day and end of the school year will resume during the summer session. Thanks so much.